morning. I'm Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and I'm so pleased to be able to welcome all of you to today's Community of Practice meeting. I'm very sorry that I can't be there in person, but today is one of our regularly scheduled public meetings for our Montgomery County Board of Commissioners. But I'm there in spirit and very grateful to Russ Johnson, who invited me to record a message for all of you today. I want to first thank Russ and HealthSpark and the entire team at HealthSpark for the incredible work that they're doing on this project. As you know, HealthSpark Foundation is supporting a 10-year effort to enhance the long-term resiliency of the safety net community here in Montgomery County. The Community of Practice has been a cumulative effort to have a county-wide dialogue about the future of our safety net system. And this really couldn't be coming at a more important time. I want to thank all of you for the time and the effort that you've put into this process. I know that it has been time-consuming. It's pulled everyone away, including many of our own county employees, from their day-to-day work. But this work is so important for the people that we serve. Without all of our collective work, the state of our and health of our community would be much less than it is today. This effort requires that our local, state, county, federal governments pull together with philanthropic organizations and community-based organizations to do our best to serve our community in the most efficient and effective ways. Montgomery County has been very pleased to partner with so many of you already in the work of Your Way Home, in the Montgomery County Anti-Hunger Network, and just together with many projects with HealthSpark. And these are just some examples of what can happen when the government, philanthropic organizations, and community service groups come together with shared goals. We can really get a lot done. So again, thank all of you for being here today. I really am sorry that I'm not there in person to hear all of your ideas and hear all the progress that you've made in this work. But please know that I look forward to a synopsis of the meeting, and I pledge that Montgomery County will walk with you as a partner in this work going forward. Have a great day.
Good morning. It's always hard to follow Commissioner Arkush. She's just been a great business partner with us for the last many years. As it says, I'm Russ Johnson from HealthSpark Foundation, and I really want to thank you all for being here this morning and prioritizing being here in Bluebell as opposed to the Comcast Center or Penn's Landing or Lincoln Financial. Because we all know that this evening is, the Eagles game, right? You're all excited about that. You'll be watching. But good news is the game doesn't start till we're done today, so you can give us your time this morning. I am really, really happy to be here and to welcome back our design team members, many of whom have been at the prior Community of Practice events. And I'm also very, very happy to welcome a bunch of new folks who have not been to our previous Community of Practice meetings. This is an opportunity this morning for you to get to know people that you don't know. So please take advantage of the time at your tables to introduce yourselves to one another, let each other know what you do, how you're connected to the safety net system, and the like. So today we're going to engage in some more conversations about the community safety net system. And for those of you who may not be familiar with what that system involves, these are the component parts of the safety net system. You're going to be hearing at your tables ideas about design team members have been working on over the last 6 months. You're going to be asked for your ideas, your suggestions, ways in which we can tie together specific ideas that benefit the entire system. So while you're being asked, we're really encouraging you. We're very welcoming of your ideas. Please don't be shy. There's a reason why you're here today, and that's to share your perspective about the safety net system. Our goals, pretty simple today. Number one, we're celebrating the end of phase 1 of the Resiliency Initiative. This time last year, we were convening many of you in this room for community conversations about what is the safety net, how should we be thinking about it, what is our vision for the safety net. and the like. So we are using that information. We created our design team structures and our communities of practice structures, and we're finished that first phase of work. So those of you who have been on that journey, thank you very much for being part of that. Second reason for you to be here today is we're going to talk about the launch of phase 2. So stay tuned. I'm not going to do that right now. The third reason we're here is trying to continue to build the base for this movement to make our safety net system as resilient in Montgomery County as we can possibly achieve. So there's a lot of work for us to do this morning. I love the celebratory mood. If you didn't get a chance to visit the easels in the lobby where the food is, please, at a break or whenever, make a point to enter that information there. So right now I am going to introduce Megan, who's going to get us to the next slide.
Thank you, Russ. Good morning. How are you all? Ready for another great meeting? For how many of you is this your first experience with this initiative? Wonderful. Welcome. We are so pleased that you're here, and we're pleased that you're joining this movement, because we really do see this picking up as a movement to change the safety net system in Montgomery County, and who knows, maybe beyond. So it is an absolute privilege to be a part of this, to have been a part of this for the past 6 months. Many of you were at our first community of practice in March, having no idea what you got yourselves into. At that event, we heard a few things about systems change. The need to be clear about why we're doing it, and yet the need to be comfortable with uncertainty. Failure equals success. Communications are so important, and everybody changes. And systems change work, everybody has to change. 6 months later, those of us who have engaged in the design teams, they met every month for 6 months, have really embraced this. We explored key concepts, we got more comfortable with uncertainty, we communicated openly and honestly, we failed, we're even planning a failure fest for some time in the future, and we challenged ourselves to change. One of the key things that we did first was identified what our guiding principles are. Person-centered design, strength-based approaches, adaptability, equity, integration, and trust. These are the values that we hold dear and that will guide us into the next phase. Building trust, we have seen as one of the most important elements of our work. Liz Pederoff, one of our design team members at our last meeting in August, said, in an outcome-driven world, how can we make sure we focus on the process? And that is certainly one thing that we've learned through this process, is that the process is so important. And of course, we had some fun along the way. We had a meeting of all design team members, so our design teams met separately over the 6 months, and at some point in the summer, I think it was after the last June community of practice, folks said, we want to get together as a full team. So we had a meeting in August where all the teams came together, and we asked them to say one word that described their experience with the design team process. Collaborative, hopeful, optimistic, those were the most common. But we also heard impactful, ambitious, enlightening, possibility, and my personal favorite was whirlwind, because it was a whirlwind. Folks came together every month and did a lot of work, and for that we're really grateful. But better to hear directly from 2 design team members who have been drafted into sharing their experiences. So it's my pleasure to introduce Marissa First of Eldernet and Samia Bristow of the Maternity Care Coalition.
Thank you for that introduction, Megan. Good morning, everybody, and welcome. I'm so excited to be here sharing my experience in the Safety Net Initiative. This is really a worthwhile and necessary cause, whatever you want to call it. It's just been amazing. And I had the pleasure of working on the advocacy and communications design team. And let me tell you, that group of people couldn't have been more passionate, brilliant, and sometimes rowdy. It was just such a joy. We engaged in fun, challenging ways of learning, of coming up with ideas, And sometimes I felt like I was back in school, markers and all, as I see you have on the table today. So when I first heard about the initiative, I was initially interested in it for a few reasons. The first was because my agency helps people of all ages, despite our name, ElderNet, meet their basic needs. Most of the people we serve live on a very limited income and struggle to afford housing, transportation, electricity, and food. Therefore, they rely heavily on the safety net system, and we rely heavily on it every day to help them. The second was because the longer that I'm in the social service field, the more I believe that working in collaborations is just the best way to work, that we can get so much more done with many minds coming together. And the last reason, and definitely the most personal to me, is that 10 years ago, I had to access the safety net system. I had small children at home, 4 toddlers, and our house was in foreclosure. We had no money, no insurance, and I was terrified. And I get a little choked up even talking about it now. I didn't know where to turn, and I felt most of all the greatest sense of shame. I didn't even tell some of my family members. Luckily, someone pointed us in the right direction to get help. We started on SNAP and Medicaid, and we were able to stabilize the family and the funds. And I was even able to get my graduate degree so that I could start my work as a social worker. This definitely isn't something I easily share, but I think it's important here because how can I work to take the stigma out of accessing services when I can't even talk about my own experience? When this initiative started, I wasn't sure what to think. I knew it was going to be an hour-long car drive, which I often complained about, and that it would take me away from my agency's work. I assumed it would somehow help ElderNet, and that would be enough. But by the second design team meeting, I was immersed in thoughtful, innovative discussions, really grasping how this initiative was much bigger than my agency. I really understood that when every person in the community succeeds, the community can thrive even more. I walked in as a skeptic, and I am ending phase 1 truly convinced and excited for what's to come next. For this experience, I am grateful to HealthSpark for taking on this initiative and for really listening to our voices and incorporating our ideas. What an exciting thing to see our group's ideas actually grow and shape into something meaningful. That's been really wonderful. This initiative is a different way of problem solving, and it is my hope that more agencies, community members, faith communities, businesses, health providers, and funders get involved. As phase 1 comes to an end, I hope that the work we did in our teams is built upon, tested, and improved. And on a slightly selfish note, I hope that we can begin to take the stigma out of asking for help. There is nothing wrong with needing some help, and this initiative has made this even clearer, and maybe even helped me heal a few of my old wounds. Thank you.
Good morning. So I had the pleasure of being asked to just share my thoughts, being a part of the No Wrong Door design team. And when I was first asked, I thought, who wouldn't want to be a part of it? Who wouldn't want to be a part of community work when you live in a community, you work in a community, and you serve the community every day? So there wasn't a question or a doubt of why I wouldn't want to be a part of such moving work in Montgomery County. I had the pleasure of working with such an elite team of professionals on the No Wrong Door design team. And this was actually the perfect design team for me because I'm a hands-on practice type of girl. It's what made the most sense for my role and my roots in the community. And what I thought was like, when I joined this team, it was like, what am I walking into? And the one thing that I did know is that anything that's worth having doesn't come easy. So like with any group, we went through group norms, forming, storming, norming, and performing. And there were tons of ideas, issues, barriers that came up. Some ideas were small and some ideas were large. But on a grand scale, we worked together to develop great ideas and great themes. And really what resonated was really start small, grow big. We had folks who represented county government. We had folks who represented domestic violence, housing, food. We had folks who were also absent in our design team that we thought should be present. And what I learned most in my work on the design team is that we must work collectively together and that all of our work intersect at some point. What I also learned was that although the work wasn't going to be easy, but it was sort of kind of like riding a bike for the first time. You have someone who's helping you along the way. You have some folks who's cheering you on the way. And there are moments when you fall down, and that's what it felt like sometimes in a group. And there were moments when you got the hang of it and you were going. I know that in my group, and just from hearing from other group members and being part of the community, no one person, no one funder, and no one agency can do this work. It will take a community effort to move this on. And being a part of the No Wrong Door team and being a part of this initiative, it didn't change my perspective, but it strengthened and deepened my commitment and understanding of what Montgomery County safety net should be. So what I also learned, there were so many resources that myself and my agency, we have not yet tapped into, which makes this work so much meaningful, because collectively we can get things succinct where we all have the resources necessary to support families and people living in Montgomery County. My hopes for the next phase of this is that everyone will find a way to get involved. Everyone will give feedback, and that the energy and momentum continues. That everyone in this room find a way to give feedback and input and charge it to move it forward. And maybe we can give some consideration to developing a leadership that can drive this work home. And the leadership would be made of community members, and that it would rise to then elevate where subgroups would be able to organize and operationalize the work that needs to be done. I truly imagine that the makeup would be of community members, providers, and leaders of Montgomery County. Thank you.
Thank you. Aren't they awesome? We had over 60 people just as awesome, and you'll know them by the green circles on the name tags at your table, and you'll have a chance to talk with them later. We asked design team members to talk to people in their programs and served by their organizations because to get some idea of what the experiences are of people who are accessing services. The good, the frustrating, what works, what we can change. As you saw, our first guiding principle is person-centered design. What does that mean? We want to be sure that the people that we're serving are at the center of all of our thinking, all of our designs, all of our decisions. So these are some of the voices, some of the comments that we heard, and Marissa and Samia are also going to share a couple of others.
So I work for Maternity Care Coalition, and a lot of our work, we work with pregnant women and parenting families with children birth to age 3. And when you work with families, you get all sorts of kinds of things. And you get the whole entire family. So although we might be dealing with small children or a pregnant woman, we also deal with folks who are now becoming caregivers for their family, folks who are caring for others, and it becomes a part of their family, so it becomes a part of the resources and the support that we provide to them. So I want to share with you a client story, not directly based on parenting or being pregnant, but just some of the challenges that our families face. In Mrs. A's words, "My mother needs help to stay in her house. She's getting confused, losing things, and can't remember anymore. I asked my church, who gave us guidance and numbers to call, but it didn't seem to have much more information. I guess it shouldn't be expected of them to know all of the resources around, should it? I wish it was an easier system to understand. That is, clearer who to call, when to call, and who could help. I don't understand that. I'm scared that something bad is going to happen to her, but no one seems to think it's as bad as I do. I can't work. I can't care for her. We don't have enough money. I'm hoping that the next place I turn to can help. This should be easy. We should protect our old folks. It's just frustrating." So while we work with pregnant women and parenting families, we also get the in-between in these type of situations. And this is a situation where we go to work, but it would be nice to know that if we had things a little bit more succinct or trampoline, as some folks would say, to catch situations like this, to really support folks moving forward. And while we know there's tons of agencies, it's really about who you know, where they are, and it would be really, really nice if we just had something a little bit more coordinated and where families can access one resource that will guide them to others. Thank you.
Okay, this testimonial came from a gentleman in his 80s. And I have to say that it took a while to even explain what the safety net system is. So after that long explanation, there was a pause, and he responded, "I don't need the safety net. That's for people who don't have any money and never worked. I just need rides from time to time because my kids are working and they can't afford to send me in cars. But if I was to give a suggestion about how services around here could be better, as my family called a few different places before learning who could help, I just think it could be easier. Like looking things up in a telephone book. Make it easy for people to get the help they need, like a big directory." That's my thinking. I think this really speaks to the fact that people sometimes just think the safety net system is for people who can't afford to get their own food only, or is for people who aren't working, or that common, well, they don't want to work, which is just frustrating. It really, to me, when he says, "I don't need the safety net," means there has to be more education around the fact that at some point or another, a lot of people are going to need the safety net if they're not already accessing it already. So, thank you.
Thank you. And also, what's important about each of these stories is that it's not just the person who benefits from the services, it's the granddaughter, it's the child, it's the entire community. So we have one more story to share with you that the Pennsylvania Health Action Network put together for us. And you'll see a person talking about his experience surrounded by his daughter and also his parents.
Literally out of nowhere one day, I was starting to have stomach pains, nausea, just weird feelings that I hadn't felt before. And it sort of escalated from there with pains in my side, more nausea. And then it got to the point where I couldn't keep anything down. Not water, not lettuce, nothing. The only issue that I had was a lack of support system. And they would not put me on the list because of that. So that's when my parents decided that I needed to move back down to Philadelphia, where I had a much, much bigger support system. I was put on the list in June and ended up getting the transplant at the end of July.
When we decided that Mike had to come to Philadelphia for the transplant, a physician friend suggested that we work through FAN in order to access Pennsylvania Medicaid. I made a call, was assigned to a navigator who provided us with both the information of how to apply for the program, what was needed in order to be approved for the program, and who also helped coordinate the actual application. She spoke with the Pennsylvania Department of Human Services office in Montgomery County, where we live and where Mike would be living. And in the course of about 3 weeks, maybe 3.5 weeks, everything was done. We received both a telephone call from Montgomery County saying that Mike had been approved, and within days after, written confirmation that he had the insurance that he needed, without which this terribly expensive transplant process and services just wouldn't have been affordable. The navigator continued to follow up with us after we got the insurance. She was concerned with Mike's progress. We've been in touch, but it was her knowledge and her dedication that enabled us to do what I really thought couldn't be done.
You know, I've come quite far since the day I was brought to the emergency room. You know, still have a long road ahead of me, but definitely making progress going down.
As you may have noticed in your program this morning, we've been doing a little bit of whirlwind planning on our agenda, but we're almost back to where we should be. Part of the whirlwind this morning was navigating the Schuylkill Expressway and all of the people who were going to work, which kept my board chair and friend Chinwe Onikre from getting here on time. But she's here, and so it is my absolute pleasure to introduce her. Chinwe's Associate Administrator at Lankenau Medical Center and System Administrator for Graduate Medical Education for Mainline Health System. Before that, she was a Program Officer with the Robert Wood Johnson Foundation, did some amazing work in New York City. She is a resident of Montgomery County, and she's a farm enthusiast. Okay. Chinwe.
Good morning. The 76 got the best of me this morning. 1 for 76, 0 for Chinwe today. So, but I'm thrilled that I could be here with you this morning and have the opportunity. I think things work out for a reason, and I think having the ground setting of those powerful stories by Marissa and Samia, I think were really phenomenal and really underscores our excitement and energy and support and enthusiasm for the work and what we've done over this past year and the work ahead. So I want to thank both of them for sharing their stories and their experiences in a really profound way. So on behalf of the Board of Directors and HealthSpark Foundation, I really want to deeply thank you all for being here today. We were really blown away by the response and the excitement today's event and to our prior to communities of practices that happened in March and in June of this year. I think what we heard from Megan and from Marissa and from Ms. Samia really underscores the power of collective action and collective work and what we can do together to achieve a common vision of creating a stronger safety net. And even though it can be a whirlwind, I think there is profound joy and excitement in that whirlwind. And so as a private grant-making foundation focused on health and human services, HealthSpark reflected on where we could have significant positive impact on improving the health outcomes of our community. We live in a county that's ranked among the healthiest in Pennsylvania and in the nation. And we clearly have many strengths that reflect the power and work of our nonprofit institutions, our public institutions, our elected officials and community leaders, and our neighbors. Yet our wealth and success tend to mask the challenges of people experiencing poverty and others whose personal assets fail to sustain and meet the basic needs. These are the people who use the safety net system. HealthSpark has made a 10-year commitment to focus on the safety net system, giving us the time and long view perspective to achieve real change. It's a somewhat audacious move, but one that we know is necessary to support the change that is required, and that is a stronger safety net. A strong safety net system is vital to the health and well-being of everyone in our communities as it produces significant results. That's everything from improved health to improved educational attainment, employment, that reduces the strains on law enforcement and criminal justice systems and the healthcare system, to improved safety, well-being, and economic health of our community. These results benefit everyone. By strengthening the safety net system, we can ensure that our neighbors' basic needs are met, and that support will be there when they, and when any of us, may need it. So the HealthSpark board and staff decided to focus on the safety net system with the intent of changing the system. This led us to design a community-driven process, which you just heard about. We wanted to hear from you and infuse your insights, your expertise into the strategy of how we approach our work. We held crowdsourcing events in 2017 to craft a vision for a safety net system and to shape the first phase of the Safety Net Resiliency Initiative in 2018. Earlier this year, we put a call for organizations and the county to participate in the first phase, a 6-month design team process to identify the needs and strategies in 4 areas: public-private collaboration, ensuring that there is no wrong door to the safety net system, which Samia mentioned in her remarks, and data sharing and systems integration, and advocacy and communication. Over 50 organizations and 10 county representatives committed to meet monthly to brainstorm and shape recommendations for projects, strategies, and research, to identify where the HealthSpark Foundation can make strategic investments that will achieve long-term positive change for our safety net system. We are grateful for everyone who participated in the design teams, and I would like for those who participated to stand so that we can recognize all of the great work that you've done. Thank you. Thank you so much for taking that audacious and bold move alongside us, for coming, for showing up, for providing feedback, for providing amazing energy and excitement into the work, and really taking us to this next level. So thank you so much. Today, we bring the first phase of our initiative to a close, as we will pivot to start making investments in the areas where we heard we need and have a potential to achieve positive change. But before we do this, we want to hear again from you and get your thoughts. There's a theme here. We really want this to be informed by what you are seeing in the community and how we can be best responsive. We are open to your ideas, opportunities, and strategies, and we really want to be challenged to do our work differently, and we want to hear from you on how we can do that. 10 years is a long time. We will continuously listen and pay attention to the policy shifts and other changes taking place in Montgomery County, so we can pivot our strategies and enhance the vision of the work that we've created together so far. But we are sure of one thing. We are committed to this work for the long haul. Strengthening the safety net system is our foundation's focus and where we invest our grant making, our leadership, our partnerships for many years to come. With this in mind, we expect to invest in ideas that will serve as the building blocks for long-term change, including pilots, research, leadership, and partnership development. We expect these investments will lead to new ideas and other steps that will lead more and more improvements in the way that we do our work and what we can achieve in our communities. We all play very different roles in this work, and we may represent different sectors, organizations, and perspectives, yet we are all essential parts of our county's safety net system. Today, we are excited to share with you what we have learned so far, where we are headed, and how we may work together. I just want to thank you so much for your support and commitment for this past year, and for your future commitment as we move forward in this journey together. I'm truly excited about the work ahead, and the collective energy in this room is palpable, so I'm excited about that as well. And with that, I will turn it back to Megan to take us on to phase 2. Thank you very much.
Thank you. So you've already heard a lot, and what we have learned is that you all like to talk to each other even more than hearing about things. So for most of the rest of the morning, you'll have a chance to talk at small tables and move around and get to know each other and exchange ideas. Before we move on to rolling out the ideas for phase 2 and asking for your input, we're guessing that a lot of you have questions about, but what did you do in those design team meetings? So for a few minutes, at the suggestion of the design team members themselves, we are going to turn the conversations over to the tables. There are 2, maybe 1 design team members at each table, so you can ask them, what did you do at these meetings? What did you learn about? Get to know the process a bit more, because we have learned that there's a lot to learn from it. So with that, take a few minutes and please introduce yourselves and ask any questions that you'd like. So much of this is about building a movement, as we said. That's what systems change is. Systems change is very complex. It means changing the way things work. And there's a couple of things that we have to really keep in mind as we do that. One is the importance of trust. So we've heard that a lot from here and hopefully at your tables as well. It takes trust to do this work. It takes trust to be able to speak up and challenge what the systems are to create change. And it takes pathways for change. We need entryways for folks to get involved. There is an intentional design of the first phase to welcome people in at different points. There is an intentional design being developed for the second phase to make sure that people can enter the movement where it makes sense for them. Some will be as grantees, some will be, hopefully you'll return to communities of practice to learn more, some will be in getting training, some will be less formal. And that's what this is about, is engaging folks where they are. And certainly a big thrust and a big priority that we've heard over and over again is how to make sure consumers and the community are both driving the change. And that's a challenge. We don't have an answer for that. You'll hear the different ways that we want to engage ideas and get more ideas. And one of the challenges is to figure that out, to make sure that we are not doing harm to the systems, because that is certainly a risk in doing any systems change. Another risk or a need is to protect the sanity, the motivation, and the engagement of everyone involved. And that's why we root this conversation so strongly in the process. Going forward, the process will be just as important as it was in phase 2. We don't have a solution to change the system today. We didn't expect that, we didn't get that. This is a long-term initiative so we can constantly learn and change. So this is a node approach. There are going to be a lot of nodes going forward, and certainly all of you are playing that part. This chart I find incredibly helpful for thinking about systems change and what's needed, but also any change you might want to make in your life. With change, what is needed? A vision, skills, incentives, resources, and an action plan. That's what we're thinking about as we go forward. What happens if any one of these elements is missing? If you don't have a vision, it's confusing. If you don't have the skills, you're anxious. We've probably all been in that space where we're doing something that we're not quite confident about. If you don't have incentives, there's resistance. And incentives sure come in a lot of different forms. There might be financial incentives, but so often we know that the incentive is to learn, it's to connect, it's to leverage each other's skills. And the design team members called the question and had a very thoughtful conversation as we go into the next phase, how can we be sure to prevent destructive competition? Those are the words that they used and they talked about. So being very thoughtful as we go forward and think about what are the resources and how they're being leveraged. If we don't have resources, though, that's frustrating. So we've all been in that position where a funder says, go do this, you figure out how to pay for it. So we do need to be mindful of the resources. And if there's no action plan, it's like being on a treadmill. So as we go forward and think through the ideas for phase 2, know that all of these things are in mind. Finally, this is the diagram that's been guiding a lot of our thinking as we go forward. You saw this in March if you were there, you saw it in June. And it's to think about the intersection of what is sustainable, desirable, and feasible. The best ideas rest in the middle. So we spent a lot of time at the beginning talking about what do we want, what's desired. But we know we have to talk about what's technically possible. So we have some ideas to present to you today, and we want your feedback. Does this feel like it's feasible? And then we'll start thinking about, as we test ideas down the road, what's sustainable over the long term to change the safety net system. So that's a bit of the philosophical framing. And if I could play the drums, I would do a little introduction to Russ, because he's going to come up here and talk to us about phase 2, where HealthSpark anticipates making investments.
So I hope this isn't the only reason that you're here, but it certainly is an important one this morning. So thank you, Megan, for helping to frame our thinking. And thank you to Chinwe and Marissa and Samia for helping to ground some of the work that we are going to talk about this morning. The experiences that the design teams have shared with one another, the information, the association, the trust building, all of it, has really been an interesting process. And I would tell you that there's been times when we've tried to constrain and get focused, and other times when, we just opened the gates and let people go where they felt they needed to venture. I can tell you that the design teams, were discreetly identified through a community process like this. But once we got them in the room and it was design team, for partnering and collaboration or no wrong door, they started to bleed into each other's territory. And that was fine too. So again, this is not a clear-cut path. We don't have the solution to create the resilient system that we are all envisioning, but we have a movement. We have you. And we invite you to stay connected to this process as we go forward. I would like to also kind of ground our thinking in the fact that the Health and Human Services system is just one system of many that exists in our community and which we interface with every day. Whether we're a foundation leader, or we're a provider, or we're a consumer, we're a resident, we're a member of a congregation, all these systems are constantly swirling around us. And so as you engage in some discussions after my comments, I want you to just keep in mind that while we're focused today on trying to tweak the health and human service system, please be mindful that there are other systems out there, ones that rely upon this health and human service system every day of their work. And those folks are working in our court system, in our probation system, in our corrections system. They are working in our education system and in many other places. So again, we didn't put up a wall to say it's only health and human services. So remember, there are people who are touching it from many, many different places. Our design teams explored possible ways to enhance the opportunities for both consumers to have a better experience with the system and for providers to feel better about what they do, to be efficient, to be professional, to make a difference in the folks that, in the lives of the folks that they support and serve. And you heard that a little bit this morning when Samia was talking about, the client is that family with that new child, but it's really so much more. It's the grandmother, it's the mother, it's the neighbor next door who provides, pivotal care to somebody. So it's really a very complicated and complex system, also with an increasing variety of populations that are bringing distinct issues and perspectives that we may not have really thought much about in the past, but which are beginning to emerge as our community becomes more diverse in any number of different ways. So once again, I draw your attention to the list of people and organizations who participated in the design teams. They have the green dots at your table on their name badges. They are remarkable pioneers who are building their systems thinking and skills. They're anxious to learn your thoughts and ideas about their work. So if you wouldn't mind just joining me right now to thank them for the work that they've done over the last 6 months. After this morning's Community of Practice meeting, the HealthSpark Board of Directors will be meeting in another room here on campus, and we will be finalizing the plans for Phase 2 work. Several of our board members are here in the audience this morning. They wanted to be grounded in that conversation this afternoon by listening and hearing and seeing and experiencing what you are all experiencing here this morning too. The framework that we're proposing for Phase 2 is designed to create and support a future phase, several future phases of work over the next several years. The board made a 10-year commitment this time last year. So we're finishing Phase 1, which happens to coincide with 1 year of work. I don't know that all future phases will be in 1 year increments, but just to say that right now we're trying to get into and define Phase 2. We think that's about a year's journey, maybe 15 months ahead of us. So here you go. You can follow what I'm going to share with you by this handout that you all have in your at your table. Phase 2 has 4 important key elements. Chinwe touched upon these in her comments. Oops, sorry. I'll try not to touch the computer again. Am I right? Okay. So grant making. Most people think about foundations in terms of the grant making that they do. Of course, we are a grant making organization, but we also do a lot more like convening all of you. This isn't a grant program this morning. Our grant making will be announced formally next month, but we are creating an innovation lab. And we will be inviting grant proposals to pilot promising ideas. And because we are seeking to change the system, we'll be seeking proposals demonstrating the possible value of interorganizational collaboration to improve efficiency and effectiveness of the system itself. The grants will be competitive, and not every promising idea will likely receive funding because, like you, we are also constrained by finite resources. So we're going to do our best to pick and support what we can. We certainly invite other organizations to join with us in this process, but we'll start with what we were able to do. The pilots, as I mentioned a minute ago, are going to span relatively short periods of time that are sufficient to test out the ideas and confirm whether those ideas are financially feasible and replicable. We're prepared to make a mistake. And as Megan suggested earlier, at some point in the future, we'll have a failure fest. But systems change work is risk-taking work. And so we're looking for you to give us your best ideas for these pilot projects. We certainly don't want you to go in with an idea that is designed to fail. We want it to work, but we recognize that as you pilot, that's a learning opportunity. And what you perceive as the situation and the circumstances for that pilot may in fact not test out to be true. So we're okay with that. So why are we doing this work? Why are we doing this grant making and innovation lab? It's because first and foremost, the design team members recommended that we do it. We also said that we need to understand what these pilot projects can tell us so that we can research and develop funds and opportunities that will move us into the next phase. So we have built in the space to learn through this process and also to find ways to share those lessons early on so that we can iteratively move forward with more pilot programs and more investments in our grant-making program. The next area is communications. Again, based on the recommendations of our design team members, HealthSpark is being asked to issue a request for proposals that is directed not to you nonprofit providers, but rather to the public relations and marketing firms that work in our region, who are interested in crafting a set of messages that recast the value of the safety net system to the community and destigmatizes its use. As these ideas are field tested locally, opportunities to build an advocacy coalition and platform are also in the mix. And we're looking for more collaborative opportunities to figure out how we can bring folks who want to join a coalition and take these messages and advance them in your own ways down the line. Again, why communications? Design team members told us it's important to do this work. They also stressed the importance of getting professionals who do this work for a living, and not just to ask folks who are well-intended, but don't necessarily understand the technical aspects of developing marketing messages to a broad set of audiences. We also know that in order for us to have impact with our work on advocacy, that we need to have the right messages, and they need to be delivered to the right audiences at the right time in the right ways. And again, bringing people who are professionals into this early on will hopefully be a key element for ensuring success. The Third element that we're investing in is research, and again, you heard that mentioned just a minute ago. We don't exactly know at this moment what research we are going to support, but our agenda for this research will be informed by the Innovation Lab request for proposals. Folks that are telling us that they want to test out a great idea may have an idea that needs a little bit more refinement and research before we can invest in it, or they can do that work. But we've certainly had a lot of ideas for research already teed up for us in the framework that if we had answers to important questions, then we would be able to focus and better inform our future work plans. So likely research might include things like identification of evidence-based models of service, what other communities are doing, thank you, Andy, looking at data systems that may support the kinds of data sharing and data integration that design team talked about and is very interested in moving forward. Addressing the issues of HIPAA, so many people have raised as concerns. We know in other communities, notably in Allegheny County, there's a task force that's already done quite a bit of work on that. We are also going to look possibly at identification of cost-effective strategies for building capacity, collect, share, and use data, redesign delivery, and strategy development for the system. Helping to identify opportunities for providers to align with the county's data warehouse system project that's underway. That's that big data cloud project that the county has announced a while ago. So all of this research is, again, informed by design teams. Our goal of sharing consumer data as consumers enter the system and to coordinate that data, obviously with consent, is also really something that I think providers have really stressed as important work. We're just not quite sure how to get there. A fully integrated data system might be possible in the future, but that's not where we can start as our first goal. So we're looking to inform how we might get there, if that's feasible in this community, and how we can chart our investments for the future to get there. And the last element that we're including in phase one is leadership development. And in this manner, again, informed by our design team members and conversations across the board, we are targeting existing senior level executives. You don't have to be the executive director or the CEO, but you should be in a leadership role, and your board members who are committed to building their adaptive leadership skills, applying those skills to leverage organizational resiliency, supporting a more resilient safety net system. So we recognize that the leaders who we're targeting already have skills. You wouldn't be a leader otherwise, even with a 5-year contract. But we're asking you to stretch your leadership skills and your leadership muscle to think about how that works in a system that you are part of. So we know that the system work requires adaptive skills to achieve that resiliency. It requires intentional leadership development to advance the community's vision for the safety net system and to align with each other. We've heard that repeated theme this morning already. So we are seeking to offer a program that many of you recommended last year as an important investment opportunity. Leadership training was not one of the design team elements, as you all probably know, but it's one that we've been thinking about over the last year and we're hoping to make available later this fall. If you don't participate in one of those 4 areas, as Megan suggested, there are many reasons why you may not do that, but we still have something that we'd like to offer for your consideration. We started this work together. We're recognizing that we've started a movement in this community. Core to this work has been a deliberate focus on establishing relationships and building trust. We're committed to keeping those elements at the forefront of phase 2 work. We want to advance this movement by testing promising ideas, learning from our failures. We want to build and share knowledge gleaned through the deliberate engagement of diverse groups in our community, and we invite partners. For some of you, applying for a grant or being part of these other pieces may not be an option or an interest, we're offering you other opportunities. We hope that you will consider participating in future community of practice events such as this one. We may not call them a community of practice, we may call them something different, but it'll look like this. We'd like to continue to invite you to visit our website so that you can learn about the RFPs, you can learn about the work that we're thinking about, you can learn about future community of practice announcements. We're also intending to create very short-term work groups or task forces to help inform RFP development as an example. And so if you've been engaged in this process and you have something that you want us to be sure to think about, that's an opportunity for you. These are going to be meetings held in the fall and throughout the spring. At least that's our current thinking. They may be telephonic, they may be in person, a combination of both, but they are short-term, once and done, maybe twice and done kind of meetings. So if that appeals to you, that's another way for you to stay involved and help guide some of our investing as we move forward. This afternoon, our board will also be discussing creation of a countywide advisory council, again, a recommendation of our design team conversations throughout the last 6 months. This advisory council would be offering high-level input to us, the county leadership team, other funders, other stakeholders in the community, perhaps small community groups, as was suggested in a comment earlier this morning. Again, all looking at how to enhance the resiliency and financial stability and sustainability of the safety net system. So in a variety of ways, we will ensure that the initiative continues to be a community-driven process. We believe in this strongly. That's why, again, you're here today. And that we hope that you will continue to offer your time and expertise and perspective as we go forward. So the other question, of course, is, this is all nice, but when does it happen? So our time for these are still under development, but I can tell you that we're intending to make an RFP announcement at the end of this month, early next month, that will create the opportunity for the, my staff is looking like I just said something wrong. Are we okay with this? Okay. No, they were multitasking. Okay, good. We're trying to make sure we get the tweets out. Okay, they're tweeting. Okay. So the RFPs for the design lab will be coming out end of this month, early next month. And we are looking to fund those in November. We are hoping to convene an action team to put the finishing touches on our leadership training program and to have the first session start before Thanksgiving. We're also hoping to bring some of you together to help form the RFP for the communications work that I described a minute ago, with an expectation that we would award a contract early in 2019. The opportunities for commissioned research that I was describing a minute ago, we're hoping to get a better idea about what research we should start with first and who should be doing that research. So I suspect that that will be coming together towards the end of calendar 18 and into the early part of 19. And then lastly, we're already beginning to talk with Megan about designing a spring community of practice to bring you back together again. So, am I allowed to take questions? No, I'm not allowed to take questions. Megan's going to come back and take over. Thank you.
I've trained him well over these 6 months. So now that's a lot to take in. It's a lot of ideas. Nothing is set in stone. As Russ said, the board will be meeting this afternoon, and the entire process is iterative. So this is a chance to get your feedback at tables. So we have a request for you. There are posters for each of the big 4 areas: innovation lab, research, advocacy and communications, leadership, capacity building. So the posters are on the table. You may unroll them. You'll see prompts on those posters, and we ask you to pick up a marker. Everyone pick up a marker and give us your feedback. 1 second, before you get started, there are a few tables that don't have a poster. Just move to where there is a poster. Hang on 1 second before you get started. I want to call your attention to two really important things. So, hey, design team members, raise your hand. Design team members, raise your hands. All right, just 1 more minute so I can give you instructions. Thank you. There are 2 questions on each poster, regardless of the topic, that are really central for us to get your attention on. One is how to embed equity into each of these areas, an equity lens, to make sure that we're meeting the resources of everyone. And the second is how to amplify the consumer voice and leadership. So in the Innovation Lab, in the research, in every piece, those are the questions that run through that we really need your thinking on. So we're going to spend a few minutes at each table, and then I'm going to prompt you to move. And that will give you an opportunity to weigh in on each of these 4 areas, and also to meet new people. So don't travel as a full table, but try to meet new people and connect with new folks. Finally, on this side of the table, there are pitch posters. So if you have an idea, if something has sparked in you that you may want to explore as a collaboration, write your idea down there, your name, your contact info, so we can connect you with each other. So with that, I'll turn it to you for a few minutes, and then I'll prompt you to move to a new table after just a few minutes. So now you may go ahead.
So please join me in welcoming Chief Warren Talbot.
So I started my career in 1990. The title of my talk is called Creating Public Value. I started my career in 1990, a long time ago. I started my career in corrections. I went through the Pennsylvania State Corrections Academy right after the Camp Hill riots, right? So it was an intense time. And I remember vividly the physical training instructor would say, the most important thing is for you to get home at the end of your tour of duty. Right, and then fast forward to becoming a police officer in 1994, the physical training instructor was the scariest person I've ever met. Kyle, if you're out there, I still hate you a little bit, but he was the scariest guy ever. He would say the same thing, the most important thing is for you to get home at the end of your tour of duty. You know, my vision of public service since those times have changed because they're fueled by my upbringing. The most important person in my life was my grandmother, who passed in 2011 at 94 years old. She was the pastor of her church in outside of Oxford, Pennsylvania. And she was just a towering figure in the community. She was very proud of me. She was born in 1916, and when I became a police officer, it was something that was really special to her because for most of her life, you think about it, there weren't any African-American police officers. So she always wanted to see me in my uniform. She lived about an hour away from me. At one point, on a Sunday, I dressed up in my uniform, and I went to see my grandmother, and you know, she was had tears in her eyes, and she said to me, you know, you keep in mind that your job is to save everybody. Right? You save everybody. And at the end of the day, if that's what you do, you can say to yourself, well done, my good and faithful servant. And That's what's been the most powerful influence for me, is to recognize it's not about getting home at the end of my tour of duty. It's about everybody gets home safely. And the vision that I think we all share, and one that can animate our purpose, is one in which we do recognize that we're in this business of human flourishing. So I want to talk about how we are doing it. You know, one thing I think is important that we sort of acknowledge from the start. You know, what I have written down on my card is we're winning, right? What we're doing is working. And part of the process of it working means that we've got to start from a place where we believe that we have the capacity to continue to win and to make a positive impact in people's lives. I've been in policing for a long, long time, and I remain relentlessly positive because I believe that we're winning. I believe that the people that we touch routinely, we're making their lives better off. And what we do is for the common good, and what we're all doing is for the common good. I don't think we do ourselves any favors if the starting point is, oh, we don't have enough, or we're not enough, or we're never going to figure this out. I think we are figuring it out. I think what we're doing now has fundamentally created a better society than we had a long time ago. I think that there's this sort of ahistorical context that we often bring to some of these discussions, where we believe that things used to be better than they are now. I heard somebody say one time that there's nothing more responsible for the good old days than a bad memory, right? It's really not an accurate reflection of reality that things used to be better. I don't know how many times I have to hear, I love the days of the police officer on the beat who used to swing a baton around his finger and sit with a child at the lunch counter and pat him on his head. That didn't exist. It's a painting, right? It never happened. It never happened, bro. The reality is that the police are more professional than we've ever been. And I think it's important that we don't let the presence, right, of cameras make us believe things are worse now than they used to be. I think we can be hopeful, right? And I'm alluding to the bad videos that you see about the police that are horrible, that make you sick. Well, they make you sick because our standards have evolved to the point where now it's no longer acceptable, right? So now we've gotten to the point where it has not increased, but what we do see disgusts us. And we've decided we're no longer going to tolerate that, which is how it should be. Right, so I want to talk about what's working for us, and I think it applies generally in matters of creating public value or creating human flourishing. 5 things: leadership, connection, compassion, reason, and progress. Right? 5 things: leadership, connection, compassion, reason, and progress. First, leadership. All right, and I want to echo what Russ had to say. A powerful part of what we can do, a powerful part of the capacity to deliver public value is to recognize how much one person can do. How much change is possible if you decide that you're going to engage every day with everything that you have. You know, one of the things that I'm committed to is that when I walk away, that I want to leave everything on the table. I don't want to end any day feeling like there's more I could have done. You know, look inside yourself, I think, to start with, and challenge yourself to live up to the mission that you've embraced. How many people do you work with that come to work every day and are mad because they've discovered the adversity that they signed up to discover, right? Like, didn't we decide that we were going to take on problems? You can't be mad when you found a problem. And because you found a problem isn't an indication that we're failing, right? It's our business. Our business is to seek out the bad things and do something about it to make it better, right? So leadership is about what can we create together. It's about something that we should be doing. Leadership is also required when logic has failed, right? Have you ever sort of encountered the person who it's like, you know, I'm constantly on a diet, and you see this diet advice that's like, eat less. Well, yeah, no, right? Of course. Of course, that's what you do to lose weight. But the point is, it's hard. So leadership is required when logic has already failed. It's about inspiration. It's about applying your energy and your passion and your knowledge to the situation. It's about making things better based on what you can do, bringing your emotion to the table, right? It's about engaging the heart and spirit. You can't do it electronically. You've got to get connected, which is the next point, right? If we're going to actually impact the problem that we set out to impact, we've got to connect with each other. You know, I'm proud that I know a lot of people here as I was floating around, that I've met a lot of people in my short time as police chief in Norristown. We've got to stop bridging divides, and we've got to stop closing the chasm and breaching the delta, or whatever tired metaphors we use. We've got to get rid of the space between us and decide that we're all trying to do the same thing, and then start asking the question, how can we leverage the best of us, right? How can we do this collectively rather than sort of operating in our own silos? This is all about work. It's about fundamentally doing things that we know actually will get the job done. Right, and sort of recognizing when we need to call somebody out for falling short. Right, we need to call somebody out because you didn't answer my email, you didn't answer my phone call. Right, you weren't there when you said you were going to be there. Connection is then about connecting and getting close to the people that we're serving. Right, doesn't suffering look different up close? Let me tell you something. If you're like me and you're confronted with the immigration problem and it's right in your face, it looks different than it does in the news, right? It looks like human beings trying to strive for a better life. And it looks like something I want to do, right? I agree, right? It looks like something we need to be doing. When you're up close with these problems, they look fundamentally different, and it allows us to reach and actually make an impact, right? Compassion. Compassion is concern for the long and short-term suffering of others. Compassion is what we demonstrate, right? And I tell the police officers this all the time. It really doesn't matter to me that you signed up to be the police. I don't care. What matters to me is what you do. What do you do in the uniform? What do you do when you show up at work every day? Right? Here's a little secret. Most crimes, who's watching this tape? Is this going out far and wide? Because I don't know how it works. Most crimes are not solved by the police. Right? I hope that's not like breaking news. Most crimes aren't solved by the police. So very often, the only thing that we have to give is kindness and compassion, right? Very often, and that holds true for many of us, that the services that we're providing very often don't land the way that we need them to land, and the only thing that we have to offer is our kindness and compassion. And if we are not giving that, we're not giving anything. So that's got to be a big part of our sort of animating vision as we move forward, is it can't just be about this result that might never come, right? The world just doesn't work like that. When we show up, right, when the police show up, the only thing I might be able to offer is to be nice. Compassion. The next thing is reason. It's so important for me to be able to connect to other people trying to do the same thing that I'm trying to do, because some stuff doesn't work. Right? If we continue to think showing up every day makes you better, we're fooling ourselves. If you're not working on your game, you don't stay the same, right? There's this notion that, well, I've been in the business 25 years. Well, you could be doing 25 years worth of dumb stuff. Right? That is totally possible. Right? We've got to recognize that there are things that work, and most of it's out there, right? We sort of allow ourselves to be veiled off from the good information, and sometimes that's about habits driving us forward, history driving us forward. We're in a day and age where the limiting factor should never be information, right? If you don't know something, I got friends on the internet that can tell you. Just reach out. So one of the ways that we've been successful, one of the ways that we've been able to achieve a big part of our vision in Norristown is to look and see what works in urban America, right? Look and see what works. Reason fuels our policing strategy. Reason should fuel our public service. If we're going to deliver service, what does the social science say we should be doing? Right? Does it say we should just keep doing the same stuff because that's what we've always been doing, that's what we're comfortable with? It probably doesn't. It doesn't say that. Right? But it does say something in particular, and I think reaching out for that is going to make a difference. Right? Reason has driven us in Norristown to engage in hotspots. It's driven us to recognize that one of the most powerful things I need to bring to work every day is the sense that we are losing legitimacy in the United States of America. And the reason why we're losing legitimacy is because we failed to recognize that we've got to make it better when we get there, right? We've got to recognize that we just can't show up and claim the moral high ground. It's what we do that matters. And we have a keen sense in this country of whether or not somebody morally should be in charge of us. Right? Do we have standing? Do we have the right to enforce the law? Because if we don't feel like the person that's in charge of us, that pulled us over on the side of the road, has the right to enforce the law, we tend to act up. Right? And when we tend to act up under those circumstances, well, then there's a reaction. And sometimes it's important to look at the ground upon which we stand and start to ask questions about how that interaction occurs. Reason has driven us in Norristown to recognize every neighborhood is not the same, right? If you're familiar with history, you recognize that there was a key decision point in the history of this country, right? In the 60s, when we started to see a different kind of environment, mostly in urban America, we had a decision to make, right? If you're familiar with the Kerner Commission report that was put out after the riots in the 60s. The report essentially said, we have a choice here to make. We have a choice here to make about how we're going to deliver kindness and compassion and care to vulnerable people. And the choice we made was, no, I'm not going to do that. What I'm going to do, what I'm going to put in these neighborhoods is the police, the prison, and the prosecutors, right? That's what we decided to do. That was our version of caring and compassion. Well, that led us down a certain path, and I think we're starting to recognize now, well, that didn't work out so well. Reason says that we've all got to come together and put resources into these communities in a way that magnifies the possibility and the power that's already there. And we've got to do it in a way that recognizes the mistakes that we made and recognizes that the divisions that we've created are artificial. Right, we pretend like we would behave differently if we lived in those neighborhoods. Let me tell you something. No, you wouldn't. Right? If you grew up in that house and went to that school and you had those parents and you had that healthcare system, you would be the same. Right? So we need to recognize how fortunate we are and how profoundly and pathetically normal the problems are that we're dealing with, right? It makes complete sense. There are some neighborhoods that were perfectly designed to create chaos and suffering, right? And it's up to us to move beyond that and deliver the service that we need to deliver the service that we have the capacity to deliver, right? In closing, I want to say that I have this deep and profound belief in human potential. Right, and that's the progress piece of this. I believe that what we're doing is working. I'm not starting from a disadvantage. I'm tremendously hopeful every single day. Being out here at this event allows me to feel tremendously hopeful because what we're doing is making better neighborhoods, it's making better societies, and we just need to keep doing what we're doing. And very soon we can walk away and let ourselves know we've been a good and faithful servant. Thank you so much.
He's a tough act to follow. Thank you, Mark. Appreciate it. Okay, so we're on our way to the end. It's been an amazing morning, a great opportunity to connect with many of you again, and for you to connect with each other. Hopefully you've made at least one new acquaintance, perhaps exchanged a business card, a phone number, an email. Sarah McCullough's shared her mobile line. She answers that 24/7. I can tell you I get text messages occasionally at weird hours when we're working on something together. So hopefully don't squander those opportunities to really keep those connections alive and to nurture them. I think that's part of Mark's message, is that we can do this as a village, not as individuals. So I laid out for you a framework of what Phase 2 is going to look like as best as we can imagine it this morning. The website address is your resource to keep connected with us. And if you don't find that helpful, here's the phone number. Feel free to call us, any of us. We're all there. We return phone calls. We answer emails. So if you have a question, if you're wondering about how to get involved in some way, please don't be shy about asking us. If you've been, in particular, a design team member, but this really is a message for anybody who's been here and been on this journey with us today and earlier, and you think that you want to help frame the RFPs that we're going to be developing and releasing soon, please consider serving on a task force. We will be posting those invitations and recruiting those folks. We only need half a dozen to a dozen of you on any task force. So don't delay if you want to get involved, and then be the 45th person to tell us. When we announce the future communities of practice, please plan to attend and bring somebody who isn't here, particularly if it's somebody who has touched the system in some way, either as a provider of service, a consumer of service, a friend or a family member who's used the system. Please bring them. We want to hear their voices. As you can see, these communities of practice are experiential. They really are designed to get you involved and engaged every time you come here, so that you don't end up just listening to somebody like me talking endlessly. If you are an organizational leader or a board member and you're committed to building your systems change muscle, please make sure that you're looking at our website about the opportunity and the announcement for the training that we're planning to announce soon. We're putting that curriculum together, we're putting those ideas together. We really want to get that up and going, and we really want that first session to happen in November if it's feasible for us to do so. And so please stay tuned to all of that. All of you, I really encourage you to share your experiences and stories about systems change and the Resiliency Initiative with your staff who may not be here today, with your family and friends. And for those of you who are involved in the nonprofit business, funders come a-knocking. They want to see site visits. They want to hear your stories. This is a story that I encourage you to be sharing with your other funders. They need to know about this work. They need to know what Montgomery County is embarking on, and they need to understand the context that you bring to this work in Montgomery County so that they can support your work in a way that's informed. I'd ask you also to consider recommitting to regularly engaging your consumers and clients. I know that you greet them, you make them welcome in your organizations, you strive to service them in the best ways that you can possibly do. But I really encourage you to step back on a regular basis and ask them, are you making a difference in their lives? How can you do better? What will make a difference to them? Not only what you can do in your organization, but I think bringing those messages back to us as we look at the system probably is a very relevant way for us to get consumer input, because it's so hard for consumers to come to a meeting like this when they're trying to figure out, showing up for daycare, showing up for an appointment, showing up for their job that doesn't give them time off, showing up for job training, showing up for all the things that they need in order to address the problems that they're experiencing. So please make a deliberate effort to engage consumers, get their feedback, and bring it to us. I'd also just like to encourage you to remain curious, focused, and engaged in our community. I think your curiosity is a portion of what brought you here, like what the heck's happening. I can remember the first design team meeting when Megan McVetti asked every one of the 4 design team participants when they came into the room. Those of you with the green dots may remember this. So Megan said, so how many of you really know why you're here today? Do you know how many people raised their hand? Not one. Not one. If you ask them today, why are you here? I think we'd have 50-some hands going up. Okay? I think the message that we heard this morning from Samia and from Marissa certainly is a testimony to what has been of benefit to them personally. But as you looked and heard at the tables where all design team members have been seated this morning, you've also heard about their journey. I think it's, their story it's been very, very meaningful. So let me just thank you again for being here today, for helping us to advance this work in our community. I know that the commissioners would have liked to have been here this morning. We frankly envisioned them being here this morning, and then we ran into some logistical issues. So I would remind you, for those of you who were here at the start, Commissioner Arkush really is acknowledging the importance of this work. She's putting her administration behind this work. We continue to see our county partners, many of whom are in this room, working side by side with us. There are fellow funders in this room who are working side by side with us. So thank you for all being here. Thank you for putting together the vision that we have to advance the resiliency of the safety net system in our community. Go forth, have a great afternoon, be safe. Thanks again.